What does FLCCC stand for?
So it's an acronym for the Frontline Critical Care COVID Alliance. And these are initially started by a group of about 4 or 5 doctors, chief among them Paul Merrick, Pierre Corey, and Keith Berkowitz, and a few others that were mostly working in the ICU during the early days of the pandemic, and realized that through some research that certain drugs, off-label use drugs, were effective in keeping people alive and out of the hospital. In a book called The War on Ivermectin, he goes through his journey with that and how he was attacked and deplatformed. But he spoke to the U.S. Congress on 2 occasions, trying to get them to approve the wholesale use of ivermectin to treat the American population and worldwide, to eliminate deaths. It sort of fell on deaf ears for the most part, and is still a controversial intervention. Not in my mind. It's very clear cut because none of my patients really died. Only very few were hospitalized, and no one died in the hospital if they stuck with our protocol. And my protocol was the same as the FLCCC. So if people adhered to the nutraceuticals, ivermectin, possibly hydroxychloroquine, they would survive. They would only be sick for maybe a week. There was hardly any or ever a need to go into the hospital. But mainstream medicine elected to go a different way of treating, not offering any treatment until they were sick enough to go in the hospital, venting, pronating, and then using agents like remdesivir, which is a highly toxic drug. And really, it's sort of that sort of treatment protocol that really was the demise of many of the people that suffered from the COVID infections. And so that organization arose from those intensive care doctors who knew and wanted to promote the idea of certain medications being very helpful.